Welcome to Growing Healthy Podcast. Today we are speaking with Di, a lactation consultant, about what are the common issues that come up in the beginning of the breastfeeding journey and how can you manage them. We will get to them right after this little reminder. The Growing Healthy Podcast and website is meant for general medical information only. This does not apply to every situation. If you have questions or if you have received different advice, please contact your healthcare provider. The views expressed by Growing Healthy and our guests are not representative of any institution with which we are affiliated. Di, welcome. Tell us a little bit about yourself.
Well, hi, Alicia. Thanks so much for having me. I am an RN in the community. I've been working in the field of perinatal nursing for about 15 years, and I do like to focus my practice on supporting moms and babes with the breastfeeding process.
Great. We kind of chatted before doing this podcast about what are the common issues that come up for women in that beginning first few days to weeks of their breastfeeding journey. And we came up with a few topics. So if it's all right, we'll just kind of get into the meat of it.
Sounds good.
Great. So let's talk about engorgement. What is it and why does it happen?
Well, engorgement sure can be a surprise for some women if they haven't heard of it before. The breast can become quite a bit larger and firmer and feel uncomfortably swollen in the first few days as the milk comes in. The body's preparing for feeding the newborn throughout the pregnancy, and the breast changes are usually noted as birth nears. The colostrum, or the early milk, is present at the time of baby's birth, but full milk production is waiting for that signal that baby is born. This is a hormonal signal to the brain. The placenta releases the progesterone, which tells the brain that the body is still in utero. So the baby's not born yet, don't start that full milk production yet. So the body's all set and waiting for the delivery of the baby and the placenta and that drop in the progesterone. The best analogy that I've heard from a recent course is thinking of the placenta as kind of like the e-brake on the car. So the car can be revving up, but it's not until the e-brake is released and let down that the car can then drive on. So the baby is born, the placenta is delivered, and it's a go. The body can now start that full-on milk production. And over the next few days, the volume starts to increase. The milk ducts fill and the breasts become full. This is also combined with extra fluid, and therefore some swelling can happen, and that's engorgement.
So I find a lot of women are worried in those first couple of days because they're like, my milk's not coming in. What do I do? But it's all part of the natural process, isn't it?
It is. Those babies' bellies are so tiny at birth. And so it's really the colostrum that they need just in those first few days.
But I know they also struggle once that milk come in.
Yes.
That's also the next struggle. So what can they do to kind of help that process?
Moms can try to help the process and try to relieve that engorgement and reduce the extent of the engorgement by feeding their babies early and often. You'll hear us say this so many times in public health, and your care providers, your doctors are going to say to you, early and often is what we need to do. So if we can keep up with the milk production and the emptying of the breasts and keeping those babies feeding frequently, then the milk ducts hopefully won't become so painfully full.
And so do you have any other tips and tricks that you can offer women and their partners to help manage the engorgement, other than that frequent, often feeding, which is really important both for you and baby?
If engorgement occurs and you're feeding your baby every 2 hours, it might feel continuous, but every 2 hours or so, you can also try some cold cloths following the feeds to reduce that swelling, and expressing the milk just to comfort would be helpful. Also trying, interestingly, cabbage leaves. So if you peel off the leaves of a green cabbage and crush it a little bit, like with a rolling pin, place it in your bra next to your breast a couple of times a day, the cabbage wilts, and there's components in the cabbage that can help to reduce that engorgement. So it's been used for many years, and it seems to be effective for some moms. They even say, don't use it too many times because it can actually decrease your milk supply.
So interesting. You hear those old wives tell, and I think a lot of them actually have some merit. But like you're saying, use it sparingly, because if you use it too much, it can actually decrease your milk supply, which is not what you want at this stage of the game.
Mm-hmm. And if you're having trouble latching your baby, because sometimes when the breasts are very full, the babies have a hard time staying on, seek that help. So ask for help early if you're having trouble latching your baby. And sometimes, it just needs to resolve that engorgement before you can get your baby on.
Right. And also probably that would be a time that you could express a little bit of milk just to help soften up the breasts a little bit to make that latch a bit easier in those starting days.
Absolutely. Okay. Right around the areola, just to soften so that the babies can have a little bit of a softer area to latch on to.
Great. And you're so right. It's so important to ask for help and get help when you need it. And there's so many places that you can reach out to. You can reach out to public health. There's Latch leagues all over the place. You can go see your family doctor, your midwife. We often have a good basic knowledge, not quite to the extent that Di does, but a basic knowledge of how to help. And then we can also get you set up with lactation consultants if we need to. And there's definitely some adjustment to having a baby at your breast frequently. Like the number one reasons that moms go to see, I think, lactation help is nipple pain. And thankfully, it's usually the breastfeeding challenge that we can most quickly resolve with a latch assessment. I feel like this is yeah. Okay. So it's so important to get help when you need it. Latching can be uncomfortable and painful, especially if you don't have a correct latch. So it's really important to get help. So can we talk a little bit more about nipple pain and correct latches?
Sure. I think that's probably the number one reason that we talk to moms in the early days or even prenatally about breastfeeding is because people are pretty terrified about hearing about nipple pain. It's often what people are talking about, and it's often what we see moms for. We certainly tell moms if it's painful, come and get help because we don't expect breastfeeding to be painful. It takes some adjustment for sure to get used to a baby being at your breast, but the pain, it often can be corrected with a latch assessment. We hear sometimes moms being told they have to toughen up their nipples, and this is a fairly common thing.
Ouch.
Ouch, indeed. And how scary to think that you might have to toughen up those nipples. And let me just tell you that nipples don't get calloused. You're not building big calluses. You don't have to toughen them up and scrub them down beforehand. But it does take a little bit of getting used to that feeling. But most commonly, it's just that the baby isn't on far enough. And so that nipple is being squashed, essentially, as baby is feeding. So we want you to remember that, babies breastfeed. They don't nipple feed as they might with a bottle. So seek some help from your doctor, your public health nurse, lactation consultant. We're all more than happy to help alleviate that pain on latching. You don't just need to push through and get used to it. And generally, if there's pain, there's an issue we can help resolve.
Now, it's not just latch that can cause nipple pain. What are some of the other reasons that this can happen? I mean, generally speaking, it is latch. So make sure that you go get a latch assessment before you make assumptions about it being something else. But occasionally, there are other reasons. And what might these be?
There might be some other reasons as well that can be cause for nipple pain. There might be something else going on with the nipple. For instance, there might even be an overgrowth in yeast. We all have yeast on our body, or candida, and given the right environment, it can have a rapid overgrowth and cause some discomfort. Symptoms of yeast overgrowth or thrush can include a burning discomfort of the nipples or areola, or shiny red skin on the areola, or even some shooting pain following feeds. Anyone that's ever baked bread or worked with yeast knows what it loves. It loves warmth, moisture, sugar, and darkness. And all of these things are present with a soaked nipple pad, as the breast milk is high in sugar. So change them out frequently and seek treatment options from your medical care provider. Thrush is generally easy to treat in the early stages.
I know there's some other issues that can happen, something called Raynaud's or vasospasm. Can you talk a little bit about that?
Well, sometimes vasospasms can occur with the nipple, either by the nipple just being compressed during a feed and coming out looking blanched, or occurring immediately after the feed. And this is sometimes just with nipple damage as babies are, not on deep enough or not with a correct latch. But sometimes there's other conditions present. If moms are already aware that they have something called Raynaud's, they might know about it being that their fingers and toes become very blanched with the cold. And this can be exacerbated by breastfeeding with the nipples. So keeping the nipples warm following a feed is key, either by immediately covering with a warm cloth or even holding your baby up to the breast afterwards for warmth. And if this isn't enough, then please chat with your doc for further treatment options.
Yeah, and Raynaud's of the nipples is often worse in the colder months. So as we're coming into winter, people will experience it a little bit more. And you're right, warmth is very helpful. Sometimes I even suggest kind of those mild hand warmers behind the nipple pads to provide a little bit of extra warmth, but not right on the nipple because that can often be a little bit painful as well. So can we talk a little bit more about latch, especially in those first few days? It's really important to focus on getting the best latch you can with your baby.
Yeah, absolutely. I agree that often, we meet moms who have just been so excited that their baby's latched on and they're having this wonderful moment with their babies that they tend to kind of overlook the pain that they're feeling, when they're feeding their babies in those early moments. So we've talked about latches, the key to successful breastfeeding. And over the last few decades, I think we've realized that culturally we've been trying to breastfeed babies in like a bottle feeding position, as in, cradled in our arms, on their back, all swaddled up. And then we, put the bottle in their mouth. And we often imagine that mom's nipple should look like a bottle nipple, when in fact, nipples can look very, very different. And babies are born to breastfeed, like I said earlier, not to nipple feed. So really, it's about latching that baby onto the breast. It doesn't always look like the baby bundled in your arms in that bottle feeding position. Babies are instinctively driven to seek out the breast by way of using all their senses and all of their body. It's pretty cool to watch those videos of babes crawling up to latch to the breast themselves after birth. And although we might not have this exact experience, it's also very cool to watch your own baby seek out the breast by bobbing their heads around and using their hands and their legs and kind of crawling up to the breast and trying to initiate that letdown reflex.
You're so right. And I think we often forget that babies are literally born to breastfeed. They're literally born to find that nipple, get on it, and get the milk from it. And we don't always allow them to follow their own instincts. We'd want to help them almost too much. And so I think it's great. We're starting to do some breastfeeding preparation classes at our clinic at Grow Health, just to kind of explain this to women, because I think it's easy to forget that it's a natural instinct. Babies have a crawling instinct. They can bob their heads. They can smell that great colostrum, and then they can find the nipple and latch on pretty effectively if we allow them to do what they're made to do.
Absolutely. And sometimes when we're trying to, we say things like, oh, those hands are in the way, and, we tidy them up and we wrap them up and we reduce that skin-to-skin contact. And what we're doing is kind of shutting them down from their natural feeding instincts. And what we know is that babies are what we call ventral feeders, meaning that they like to have their skin touching mom's skin, particularly on their chest. So they really like their chest touching mom. So we talk about things like, lining them up belly to belly, and we line them up nipple to nose, and these things to remember. But they do tend to feel calmer and more regulated when they're focused on feeding. So when they have that skin-to-skin contact, especially with those early feeds, they can go with what they're hardwired to do. We also know that the depth of the latch is important for both the comfort of mom's nipples and also for the best transfer of milk. So using gravity to baby's advantage can be really helpful.
And I think you call it the TV lying position. Is that right?
This was from Nancy Moorbacher, who's a fabulous breastfeeding expert in the world. And I went to see her a few years ago and, expecting to get some real scientific info. And what she said to us was this: we really need to get moms back into the right side of their brain, that sort of non-logical, more instinctive side of their brain. And so she literally tells people, just get down into that TV watching position and get comfortable, allow yourself into the right brain, and just, connect with your baby. We don't have to be so picture perfect with it all, but get comfortable. It shouldn't be pinchy, so moving baby around. We really want to get that depth of latch. And when you lie back with your baby, you're allowing gravity to have baby get on the breast deeper. If you're sitting up with your baby, as soon as you relax, baby falls forward, your arms fall down, and we have baby sort of sliding back down onto the nipple. So getting them latched on, leaning right back, allowing gravity to do its job to get that nice deep latch. This can be really helpful.
Great. And I think it's also important to remember that this is new to both mom and babe. So give yourself some slack. It's a new skill for everybody. And certainly if you don't understand what we're talking about today, certainly kind of ask your care provider what the best skills are. If you're in Victoria, if you're a patient of Grow Health, you're welcome to come to our breastfeeding preparation classes, and Di or Dr. Emma Noble will go into that a little bit more in detail, but we'll try and see if we can post some good pictures to kind of demonstrate. So now earlier we talked about feeding your baby often, especially in those first few days. And part of the reason babies need to do that is to help mom's milk come in and to signal to mom how much milk they need. And I guess, so how do moms know if they have enough milk?
Yeah. And this is another common concern that moms have. They sometimes, especially if they're feeling anxious around, their baby's getting enough and that they're growing enough, and they feel a little bit more reassured if they can look at that bottle and say, oh, I know my baby fed exactly 1.5 ounces or whatever it might be. But this is the other part that we need to kind of slip into that right brain with babies, is that we don't always know exactly how much they're getting when they're breastfeeding, but we know that they're getting enough when we look at their output. and their behavior. So babies have a great way of communicating with you. You know, those little fists up tight next to the mouth and they're sucking on their hands. It's like, I'm a hungry baby. This is a hunger cue. And when, you know, their hands are relaxed and they fall away from them, it shows that they're a little bit more satisfied. We also look at their sucking cues and their rooting reflex and this sort of thing that you can watch with your baby. And the other thing that sometimes moms worry about is in the early days that babies want to feed really, really frequently. And sometimes they even do what we call cluster feeding, where it sort of feels like nonstop for a few hours in a row. So it's really normal that babies will feed every 2 to 3 hours. And then in addition to that, they'll do a little stint of time where they cluster feed. This doesn't mean that you don't have enough milk. It's just how babies behave.
And I think it's important to remember that babies have a tiny, tiny little stomach when they're born. And so part of the purpose of this is you're not producing a ton of colostrum, but the colostrum you're producing is very high in calories. And your baby is just working on stretching his or her stomach out slowly over time. And so those first few days, it's all about getting little bits quite frequently. And as their stomach gets a little bit more stretched and as your milk comes in more, that becomes less and less frequent. But those first few days, there's a lot of time breastfeeding.
Indeed. So we look at our babies, you know, if you're worried about how much they're getting, look at how much they're peeing. We want them to pee as many times as days old in that first week. So for instance, if they're 4 days old, we want to see at least 4 pees. By the end of the first week, we want them to be peeing, about 6 to 8 times a day. And then you're seeing that their stool changes color and it becomes more yellow typically, and that they're giving you a couple of those a day. If you're concerned at all, again, check in with your doc or your nurse. You know, one thing that we really need to remember is that human milk is designed for human babies. So there's nothing wrong with your milk if your baby needs to feed frequently. We often sort of imagine that we can feed babies, you know, once every 4 hours and we put them away in their crib or perhaps in their nursery and they're going to come back out again at that 4-hour point. But in fact, another point that Nancy Moorbacher made in this talk that I saw her with years ago was that we're carry mammals. So like chimpanzees, gorillas, any other primates, we're meant to carry our newborns and we feed them often. We're not follow mammals like horses, you know, or giraffes or whatever. They have to follow along and occasionally they catch up to their mom and get a drink of milk a few times a day, but we are the carry mammals. So we feed really frequently, and that's how our milk is designed, and that's what's best for our baby.
I think we all want to have a predictable schedule, including feeding times. And oftentimes it does get there after, you know, a month or 2 or 3, but certainly not at the beginning. I actually asked a group of women once what they wish they knew in the first few days after giving birth. And one said that if your baby seems hungry, feed it. Don't try to stick to a 3-hour schedule. So, Di, we've talked about where we can access help. So, the Latch League, public health, your physician or midwife's office. What are some of the other things that you think is really important in those first few kind of days to weeks of life?
Yeah, I think, you know, really identifying who your supports are in your life. If you can do that before baby's born so that you know you've got some adequate supports of people who you feel comfortable with around you. It means perhaps the difference of a mom being able to spend some quiet skin-to-skin time with their newborn instead of needing to shop or cook, or being able to just catch up on a bit of sleep to allow them that recovery time from birth. Or even just to be able to talk about how you're feeling and just to feel heard and not alone with your new parent struggles that you might have. It can make moms feel just validated and supported, even something as simple as that. So we encourage you to reach out with who you would identify as a support person.
I think it's also really important to mention the dads here because I know a lot of dads really want to help, really want to be supportive. So I think it's really important to let your partner know very clearly what they can do to help you, whether that's to take the baby for an hour or 2 so you can have a good nap with some earplugs in and know your baby is safe with your partner, or whether they can go do the grocery shopping, or whether they can clean the bathroom, whatever it is you need. Ask nicely, but clearly for the support that you need as a breastfeeding mom.
Absolutely. There's so much that can seem like a little thing, but it just makes such a huge difference for a new mom. And just remembering, you know, to voice, you know, like let people know how you're feeling and what you need to have happen.
I also say, you know, when you have visitors in the first week of your baby's life, put them to work. They all want to help. Put them to work. Tell them to bring a casserole. Tell them to clean your kitchen. Tell them to go grocery shopping. That's what they want to do.
Now's the time. Absolutely. People want to help.
So I think that's all great advice, Di. Thank you so much for coming and chatting. And it is really hard to ask for help sometimes, but trust me, you'll not regret that you did. And a little help early on in the journey can make a huge difference in your infant feeding experience. Our hope is that it makes it more enjoyable for both you and your wee one. And certainly we will put some links and resources, especially in and around Victoria where we are. So check them out. And in the meantime, keep on growing healthy.